happy we're live.
Does it come on your...
Hello everybody. I think it's 11:59. It might be, but we are live.
I'm just going to close these things. Is that okay?
Absolutely.
It's just making it run really slow.
We're just getting some technology sorted.
It looks like we've got 8 people watching. That's good.
We have 8 people.
Fabulous.
Okay, that should help. Good afternoon, everybody. Welcome to today's Facebook Live with Maternity Voices Partnership. Today it's Meet the Matrons and the Deputy Head of Midwifery. So what we thought we'd start off with is just introducing everybody, tell you all a little bit about our role, and then open the floor up to you to be able to ask us questions. So with us today we've got Milica Redfearn, who's the Deputy Head of Midwifery for Community Services and Public Health, Wendy Tyler, who's the Matron for Community Services and Public Health, Emma Rigby, who's the Matron for Antenatal and Tertiary Services, and myself, Jane Upham. I'm the Matron for Inpatient Services, so that's the antenatal ward and postnatal ward, also bereavement services, and I lead for recruitment. So I thought we'd start off with Milica, who's going to tell you a little bit about her role.
Thank you. Thanks, Jane. So as Jane said, my name is Milica Redfearn. I'm the Deputy Head of Midwifery for Community Services, Safeguarding and Public Health. So within my remit, I lead on the 9 community teams, the birth centres, the spires, which is obviously attached to the JR, as well as the standalone units across the county. And obviously I lead on the infant feeding under the public health, infant feeding, vaccination programmes, etc., and safeguarding. And I have the very new matron who started in post last week, so I'll hand you over to Wendy.
Hello, I'm Wendy. This is my 6th day in post, or my 7th week, so bear with me. I've just come from the Spires, so I was the team lead up there, so I've kind of just gone up a little bit. Spires is still my remit, as Melissa has said. I've been a delivery suite coordinator, and I've also been the ward manager of level 5, which is our postnatal ward. And some of you may remember me. I did a Facebook Live last year, I think, for level 5. So this is my 2nd time here. And yeah, like Melissa, I work really closely with her, sort of in charge of the community teams and the birth centres and public health as well. So that's, like we said, BCG, neonatal screenings, that's the NIP check, the initial check, all the vaccinations, mental health, safeguarding, birth after 4. So the public health's got quite a wide
remit.
Yeah.
Thank you.
Lovely. And I'm Emma Rigby. I'm the Matron for Maternity, Outpatients and Tertiary Services, which, to explain a little bit, it's all of the outpatient clinics that you may come to the hospital to see consultants or doctors, so that may be here at the John Radcliffe or possibly at the Horton in Banbury. And I'm also Matron for the Fetal and Maternal Medicine unit as well, where we'll see the higher risk women and their babies.
Okay, thank you. So as I said at the beginning, I'm Jane Upham. I'm the Matron for Inpatients. So that's level 6, which is our antenatal inpatient ward, and level 5, which is our postnatal inpatient ward. I also lead for bereavement services, which are predominantly based upon level 7 with the bereavement team. And I lead for maternity recruitment, so I'm the person that's responsible for recruiting midwives and support workers into the organisation. So I wondered if anybody had any questions for any of us. I think one thing I just want to add is that Laura Jones, who's our matron for delivery suite, can't be with us today, but the expertise of Wendy over here as a delivery suite coordinator, I'm sure between us with Wendy's leadership we will be able to answer hopefully the majority of questions that might be linked to delivery suite or maternity assessment unit or high dependency unit. So Emma's very kindly got the iPad here with all the questions. We're all quite novices at this, so I hope you're patient with us, but we'll do our utmost to give you as much information as possible.
Yeah. So we've got some hellos.
Oh,
hello.
We've got currently 25 people watching, which is great.
That's great news.
A few hellos. Sarah has said hello and has thanked us for doing this.
You're very welcome.
And Natalie, hi guys. Lovely, lots of waving hands. So hi Natalie.
Hello. I think we'll just take a point here just to say that obviously these are new sessions and we've got some exciting sort of speakers coming up, haven't we? And which we've done a rolling rota, so you'll be seeing Facebook Live via the MVP every other week. And obviously we'll have representation from all our community and inpatient services. And I think if there's anything in particular that you would like to see from these sessions, then please either pop it in the chat there or let the MVP know, and they will let us know, and we'll do our utmost to facilitate that for you.
Thank you.
So we've got a comment from Charlotte who says, "Hi ladies, hope you're all well and keeping safe."
Thank you. Yes, we are.
And she just wants to say a big thank you to the Spires for all their help at the first lockdown. And she gave birth to her baby daughter, Alicia Jasmine.
Aww.
And also thank you to Level 5.
Yes.
So that's
Thank
really
you.
nice. Thank you.
We'll make sure all the teams get to hear about this lovely feedback, because I know that they're really keen to hear anything that you've got to say. So we'll share all of this with them. Thank you.
Absolutely. Tessa has made a comment saying thank you for doing this, but she did have a 5-hour delay at MAU, which we know is really difficult, and sometimes we just can't, the demand is quite high in some of our services, and it has been particularly recently.
Shall I go as well?
Yeah, that would be lovely. Thank you, Wendy.
Emma is currently undergoing a really big, significant review. We're sort of looking at staffing, we're looking at rooms, we're looking at pathways, the way we triage women over the phone. It's a huge undertaking, and the idea is to minimise those waits that you're having. And 5 hours is not acceptable. Even an hour is not acceptable. So it's not something we want to set out to do. So we really, really want to make this work for our women, and we want to make it really clear as well where they go and who they need to speak to. So I know that Laura and Catherine are working really hard on that, and actually I think there was another meeting about it today, so it's definitely something that's happening as we speak, with the hope that women are seen by appropriate services. If you're low risk, you don't get seen on MAU, you go to Spires, for example, and that you're seen a lot quicker as well.
One of the key messages is that we're thinking, where is the best place for women to go? And if women are in labour, is MAU is pretty much our A&E department for maternity services, so is that the right place for women in labour? Should they just actually go straight to our delivery suite or the Spires? So those are that's a big thing that we're looking at, and I think we're making a really positive impact on the experience that you're having when you come into the hospital.
Lovely. Thank you. I hope that answers your question. Tessa actually said she posted only half of her question. A little bit previous, sorry. So Tessa just wanted to know, was there still long delays, which I think we've covered.
I think it is something that we've identified, and as Wendy and Jane have both just explained, we are looking at those pathways into hospital, and across the service,
And we're sorry you had to wait that long.
Absolutely. So we've got a comment from Harriet. Thanks for doing this. Just a practical question, as Harriet's booked at the JR. I believe we're not able to visit the labour ward at the moment, so I'm wondering if it's possible to use a birthing pool on the labour ward, and how many are there? Thank you.
Do you want me to do that one again?
You can.
Thank you.
So we have 1 pool on delivery suite and 3 on the Spires. So assuming that you need to give birth, or you've been advised to give birth on delivery suite, we do have the 1 pool down there. We have a really open policy on use of water in labour, and we sort of encourage it in a lot of high-risk circumstances to try and normalise your birth. We also have what we call telemetry, which is, I'm assuming that you're high risk, you might have been on the CTG, which is the monitoring of your baby. Probably if you've been upstairs on MAU, you've seen it's connected to wires. On delivery suite, our labour ward, we actually have wireless ones, and they have a really, I think it's like 30 minutes, something crazy. It's a really, really good range, so that you can even get in the pool with wireless monitoring on. And we really do encourage that, stay mobile. You might, have to get in and out for assessments and things, depending on how the labour's going. But our policy covers a wide range of high-risk circumstances that we still encourage use of water in labour. Hope we can answer the question.
let us know, Harriet, if there's any other information you need to know. Helen has messaged us just to say, asking, do you find that most women write a birth plan?
Should we do that one?
To be honest, I think that's quite individualised, isn't it? You know, I think if you, for me, if you've got, you know, any special wishes or anything like that, it is nice to have that plan and sort of discuss it with your community midwife in your pregnancy as well. Obviously, the requirements may differ depending on whether you need obstetric consultant input or whether it's midwifery-led care. But yeah, I think it's nice to have a plan if you have any special wishes.
Yeah, I think we want to know what's important to you. When I start looking after a woman in labour, the first thing I do once I'm sure everything is safe is the first page I go to is the birth preferences page, which is the start of your labour notes, sort of halfway through your blue notes. It's just a white card and there's like an empty box. So your community midwife might fill that bit in, or you can write what's important to you in that box, and that's one of the first places I'll check. So it doesn't have to be pages and pages if you don't really have too many strong preferences. But that box is a really useful place to say, what do you like to be called, for example? Because some women don't want to be called by their proper name. It's simple things like that can make a real big difference to you in labour. So if you write it in there, if you don't want to write a full birth plan, that's a really quick way of doing it, letting us know what's important.
And I think it just opens up discussions between you and your midwife as well. If you've got any, as I say, special wishes for your labour and birth.
I think as well, when you first come into hospital, there's a lot going on. You might be in the maternity assessment unit, you might have to wait a while, you then get moved somewhere else, and I think it's, you're probably in pain, or you're experiencing contractions, so it's useful for you to have known that you've thought about it and you've written it down and you know where it is, and it's a good referral point as well when you come into hospital. So yeah, I think they're hugely beneficial.
Absolutely.
Thank you.
Hopefully that answers your question. Lee has asked us that she wants to know if you can have one or two birthing partners at the moment.
The current guidance within the maternity services is one birthing partner. And that's linked to COVID restrictions. It's not a maternity-based answer. It's linked to COVID.
Yeah, it's a sort of a trust-wide, isn't it?
Yeah.
As opposed to maternity. But it is something that we are consistently reviewing, obviously with the situation nationally, and obviously, you know, when decisions are made, they are communicated across the service.
Okay. So Roxy is wondering about the one birthing partner only rule, and just wonders, do we see this changing at any time in the short term? And it's concerning her, and I think it's something that we are absolutely reviewing at all times. But as Melissa said, it is something that comes. It's across the board for Oxfordshire at the moment.
I think the key message is we need to keep women that we care for safe, their partners, the staff, and the other patients. We've got to remember that it's more than just one person, it's a group of people that need to be kept safe. Yeah. What we don't want to have to do is go back on the decisions that we've made, in that, for those of you that were around at the beginning of COVID, it was birth partner only for delivery. There was nobody on the postnatal ward, you couldn't have a partner with for antenatal scans. We really do not want to have to go back, and we have no intention of doing that. So therefore we want to try and keep it as safe as possible, so we can keep birth partners for all appointments, all scans, the whole of labour, the 12 hours a day on the postnatal ward and the antenatal ward. So we want to be able to maintain that, and I think at the moment we feel that this is the best way of being able to do that. I don't know if anyone else has got anyone else to add.
It has to be a staged approach to really.
Yeah. And that's with consideration to obviously, the national stance on COVID, and obviously the recommendations that come across nationally. We're continually looking at rates and obviously what impact that's having on women, and obviously with the newish Omicron, we have seen staff reduction, as well as we know more people coming through the service, birthing people coming through the service with COVID as well. So again, it's as I say, we're continually looking at it and making the assessments to keep everyone safe, as James said.
You've got to remember that there's still large numbers of pregnant women that aren't vaccinated, which is why we have to be particularly careful to keep our pregnant population as safe as possible. But yes, as Melissa said, we're reviewing it regularly. Thank you.
Thank you. And hopefully, Gemma, that answers your question. Sorry, Gemma Louise, you were wondering why Swindon were allowing 2 birth partners and Oxford are just 1, but I think hopefully it's explained clearly for that. Kaiser has helpfully commented on Helen's comment about the birth plan, and she's just put preferences are useful because they can be adapted to any circumstance, even if your plans change.
It's a good start point.
Yeah. So Helen has asked, is it beneficial to use something like an Annie ball to reduce the risk of tearing? Over to you, Wendy. No? Okay.
I would say the only thing that I know is evidence-based that reduces your risk of tearing is massage.
Yeah.
And that has strong evidence in the literature. And I think I'm always quite cynical about things that cost pregnant women money, because we see it as well. There's lotions and potions you can buy. I think it's called My Expert Midwife. None of that's actually got a strong evidence base. If you want to use something, use it as the source. So pure aromatherapy oils, for example, rather than buying a product that's been dressed up and advertised and has all this extra bump on it. When it doesn't, I feel that sometimes pregnant women are a useful market for profit making. So I myself quite cynical about that. And for example, perineal massage is free. So it's something you can just do in your own home environment. You don't have to buy anything special for it. If you want to, you can use aromatherapy oils, and you can use them pure rather than buying things like My Expert Midwife, which I think is like £20 for a tube of cream. So if you're not sure, just really be critical about who's made it, where their background is, where it's come from, and what evidence they have. But I confess I've not actually heard of it, so I might be wrong.
Helen has given us a link for it, so
Fantastic.
we're going to look at that.
Have a look at that.
I'll educate myself.
Thanks, Helen. Yeah.
Katie's asking, says hello, and is there a possibility to use a private room post-birth for recovery in Spires or the delivery suite? And she was on the wards last time and found it very stressful.
Talk about Spires.
So the Spires rooms, all of those rooms are single rooms. So if you birth on the Spires, then you're automatically in a room on your own, as long as you remain low risk and there's no complications. At the moment, all of our single rooms that are on level 5 are actually for clinical need. So we aren't actually offering at the moment the chance to pay for a private room unless you're actually a private patient. But that should change. That's not long term. It's just at the moment we're having to use the single rooms for clinical need.
Okay, hopefully that answers that one. So Roxy has asked maybe a question for you, Melissa. Can you choose to home birth even if it's not recommended by your midwife? Would you get a midwife to come to you, or would it be just a case of having an ambulance?
So I think for any home birth, obviously we do a home birth risk assessment. So again, that would be completed with your community midwife, and obviously if we do have instance where we may not recommend that you had a home birth in view of your obstetric history, your history as it is, but in that instance we would recommend that you would come into maybe through the birth choices clinic and have a multidisciplinary, so there you'd have a midwife, you'd have a consultant obstetrician there as well to sort of discuss again your wishes and how we can facilitate your wants really. So I wouldn't say anything sort of off limits. We will have recommendations, but I think at the end of the day, it's about you making an informed choice in your own care, and having all the information, having all the risks given to you, and having those shared decision making, I think, is the key here. What was the second part of the question?
Do you have your own midwife come to you for a home birth, or do you have to have an ambulance?
So we have an on-call for home birth. We don't have a home birth per se here. What we do have is we have an on-call midwives, community midwives who will be on call for home births. So that could be, we do try and sort of, hopefully we try and facilitate a midwife that you may be within your team. For example, if you are a Banbury woman, it would be a Banbury midwife. That would depend on, obviously, if you went into labour and wanted a birth and there was a Banbury midwife on, then she would come to you in the first instance. However, sometimes we might not have a Banbury midwife, so it may well be that we have a midwife from Bicester, say, that comes to you. So yeah, it would be a midwife that came to you if you had a planned home birth. The only instance that the ambulance would come to you if, unfortunately, you birthed without a midwife. Well, birthed quickly and we didn't get a midwife to you in time, and then we would advise you to call an ambulance.
Yeah.
Is there any other comments on that?
I suppose the only thing is to say that we have had an occasion over the last few months had to suspend the home birth service because of staffing. When we have limited staff, then we have to direct them to where we feel it is most appropriate. And when that happens, then we can't provide a home birth service. If that situation arises, then we would strongly suggest you contact an ambulance. But that doesn't happen very often, and it's certainly not what we're aiming for, and it's not what our vision is. We very much want to provide a community midwifery service that supports women to have birth at home when it's safe to do so.
That's it. I think that's the key message there, isn't it? That we want to provide a safe service. Yeah.
Okay, hopefully that answers your question. Charlie is asking, do you have your own room on the delivery ward? And how many rooms have a birthing pool?
Do you need to do that?
Yes, you do that one.
So yeah, all rooms on delivery suite are single rooms. The only downside is that we don't have en suites apart from in one room, and that's just because of the age of the building and the geography. It's something that maybe will hopefully change in the future, but it's not something that we're able to change at the moment. There are things you can do to help mitigate the fact that you don't have access to an en-suite, and your midwife will be able to talk to you that in labour about your different options. But yeah, they are all single rooms, and we have one pool on delivery suite, and we have 3 pools on the spires.
Lovely. So we now have 47 people watching, so that's fantastic.
Hello,
38, sorry. So, being asked by Bex, is it likely that Wantage Midwife Centre, Community Hospital, will be open for births before May? And what are the reasons for it currently being closed to births?
So we've got a review coming up of the home birth service, or the birth centre services across the county, coming up in February next week actually. Again, it will be very dependent on sort of providing a safe service. And unfortunately, at the moment, we have to look at staffing and how the on-call midwifery cover is, etc. So we review the whole service and then make a decision from then. So I can't give you any exact decision on that yet, because we haven't had those conversations and we haven't had a look into sort of our resources yet. But that will be happening, and again we will use MVP for any sort of decision, communication of decisions moving forward. But we're hoping, obviously, as we get out of the sort of the winter season and moving on from the COVID situation, or the current situation, that we can introduce and open and offer women those services. Do you want to add anything, Wendy, there?
No, just that we don't want it closed. We don't want to see it closed.
No,
obviously,
no.
we don't come into this job trying to take away choice from women. We obviously want you to have as much choice as possible, and we don't want to see them closed. It makes us, it's frustrating, isn't it?
Yeah.
But it almost stuck between a rock and a hard place at times of trying to make sure that the women who are in labour across the county have access to a midwife when needed.
Again, it's that safe service that we
Yeah.
want to provide for all women.
Okay, so we've got a little pause on questions
Oh,
now.
okay.
We've got 41 people watching.
I quite like to see the link to the Annie board.
Are you asking me to try and move off this onto a link? There's
That's not a good
no
idea.
So you can always just say hello to us. You can give us some feedback about your experiences. If you've got questions to ask, anything that you want, we're here to try and help. Oh, lovely. Thank you, Harriet. If the birthing pool is occupied on the labour ward, are there any other water options?
So I mentioned earlier that we have telemetry on delivery suite. So assuming that you want to give birth on delivery suite and you've been recommended and you're very happy with that, in terms of water, you could still use the showers on delivery suite. So I think there's 4 showers. So you'd have to go across from your room into a sort of bathroom, but the wireless monitoring that I've talked about earlier does have the reach. So if you were needing to be on continuous monitoring, that would extend to the shower, and it would still be waterproof in the shower. So that's a potential option. Apart from that, no, there's only one pool on delivery suite, but we do know the benefit of turning that room around quickly. So all our staff, including our midwives, are trained on how to clean the pool, for example. So if a woman has recently given birth in there, it's appropriate to move her to another room. We will do that because our room's very close that we can move her to. And our staff are very good at getting that room turned around. We have a really amazing domestic team that work really closely on delivery suite. And they just work on delivery suite, and they're really good at getting those rooms clean. So we do know the importance of water, and we do work really, really hard with our domestic team to clean those rooms. And our midwives will also clean the pool. I myself, I've actually looked after a labour before and gone and cleaned the pool while she was waiting and moved her across myself just because she was so desperate to get in the pool. And that worked well. So we all get stuck in. If we know one wants the pool and it's just a matter of cleaning it, there'll be someone there to sort that out. I don't think there's any other options apart from the shower.
Lovely, thank you. Rebecca has asked, what are the current visiting rules for the postnatal ward? If she has a planned caesarean in the afternoon, how long can her partner stay?
Okay, so the visiting for the postnatal ward, and the antenatal ward is exactly the same as well. It's 8 o'clock in the morning until 8 o'clock at night. So, and that's, that's what it is. The question in relation to the C-section, your partner will be able to stay with you whilst you're on delivery suite in the recovery bay for the after your C-section. And then depending on which pathway you're on, so some women get moved directly up to the postnatal ward from the recovery bay on delivery suite. Some women get moved to the observation ward for a while before they go up to the postnatal ward. Up until 8 o'clock, your partner will be able to stay with you on the recovery bay, and then obviously he or she would need to go at 8 o'clock, as they would if you'd been on the postnatal ward. So basically, after your C-section until 8 o'clock that night, your partner can stay and then can revisit at 8 o'clock the next morning. I think that probably is the easier way of saying it.
Yeah. So if they go through the sort of recovery area, they can just go straight up to
Yeah, depending on which pathway you're on.
Yeah.
They're on. Some stay downstairs for 2 hours on delivery suite and then move straight up to postnatal. The partners will go up with you at that point on the elective section pathway. Some have to go to the observation area for a bit longer if there's been complications that they might need to stay on level 2 on the delivery suite ward or observation ward for a bit longer. But yeah, 8 till 8 in the daytime. And that applies to the spires as well.
Yeah. Lovely. So Harriet has thanked you for the information about the water.
No problem, Harriet.
So she says great. So Rachel has asked, my last labour was back-to-back, and I've been told I have an anterior placenta this pregnancy, and this can this increase the chance of back-to-back labour again?
No. I was only going a bit.
Sorry.
No, but what I would recommend is going on using upright forwards open. So that should just be your motto, especially for third trimester. So for example, when you sit in the car, making sure your knees are lower than your hips. And the sofa as well, that applies. So just making sure you're not bringing your knees too high, opens your pelvis. Bouncing on a ball at home when you're watching TV, gently rocking your hips. All these things are going to encourage baby to rotate and descend into the pelvis, even when you're not in labour. But even if you're told at, say, a 36-week appointment, your baby's back to back, don't worry. Babies rotate up until the point their head is literally born, and even then they still rotate. So it can change at all points during labour. So my best advice would be don't get too fixated on baby's position now. Actually, don't get fixated on it at all. Any midwife worth their salt will be able to recommend positions to you during your labour to really help if your baby is a little bit stuck to change positions. There's loads of things we can do, sort of exercises and positioning, and water's a really good thing for that as well. I hope that answers the question.
I hope that does. Helen has said to us,
I'm going to have to log in again. I think it's still going on in the background.
okay, thank you.
So we've just got a bit of a technical problem here, just bear with us a minute.
Dear, I hope you've probably got my face up too close.
Automatically
Logs
I'm not sure
down.
whether you can hear us or not, but if you can, we'll just...
I think we might be back. If you can just send us a message to let us know if we're back on.
Maybe have to just give the thing a wiggle in a bit, Emma.
Yeah, I think it's a half an hour.
Oh, okay.
Yeah,
Yeah.
yeah. So can you see us? Let us know. Can you hear us? Let us know. Yes, we can see us. Midwives and technology.
Bring a techno person.
So Helen has messaged us saying on the December birth infographic for Oxfordshire there was a high percentage of caesarean sections. Are we finding that more women are ending up having a section, and why is this?
Our section rate has gone up. We are aware, and there are we have meetings about this every month about our caesarean section rate, but it is actually in line, unfortunately, with a lot of other trusts. It's not unique to us. It's something that we are very acutely aware of, and not something that we're necessarily over the moon with, but we also, I don't be surprised by the data, because I think it's matching with the UK. Would everyone agree?
Yes, absolutely.
And we do look at what we can do. We do look at if there's something else that's changed that might have increased our section rate. We are introducing, I think it's actually this week, a new way of assessing and working out if your baby is well during labour, so looking at fetal well-being. And we're hoping that will hopefully have an impact on our rate of interventions during labour.
Yeah. I think it's important to say as well that because we are a tertiary referral centre, we have some of the higher risk women and higher risk babies coming through, where these women and sometimes these babies, the only option for delivery, the safest option, is caesarean section. So our rates are a little higher because of that. I hope that answers your question. So lots of haze and thank yous. We're losing a few people. We're down to 37 people watching.
No.
Hopefully it's because their questions have been answered. So any other questions? I'm just checking that we didn't lose any questions during the little glitch. So we've got Abigail saying hello, and Rachel saying thank you for the information for her back-to-back pregnancy, so that's great.
There's a website, it's really bugging me, I can't remember, and there's going to be some community midwives screaming at the screen right now.
They do
like
something to do with rotating.
Sideline release, and they do Robozo on there. I remember those.
Well, we could, if anyone does know, can you
Yeah.
post it in the
Spinning
tab?
Babies?
Yes. That's really, really good website.
Yeah, Spinning Babies.
Thank you, Emma. What did you say in the comments?
No.
There's a lot of people party care.
Just to remind you, Outpatients. Kaiser, I hope I've said your name correctly. If someone chooses to free birth, who do they contact to notify of the birth?
Do you mean it just called the community midwife at the time that's convenient for you. So if it's at night, you would call Wallingford as normal. And if it's during the day, you could either try and reach your community midwife team. You can still call Wallingford. And it's when you feel you want a community midwife to come out to you, or you might just be calling them to notify them of the birth. And we'll record it on our electronic system, and we can register the baby's birth if we've got some information. To register the birth, we generally need the weight of the baby. So if you're accepting of it, you might call the midwife, and then they might arrange a visit to you whenever you feel ready, really. Does that answer the question?
Yeah, I think as well is that obviously we would strongly recommend that you didn't free birth, but in the antenatal period, if it's something that's crossing your mind or you're thinking about it, that you do contact your midwife to have a conversation and to see what support we could put in place, so we can facilitate your birth choices. Because free birth is not a safe option.
Yeah. It comes with its risks. Yeah, absolutely, Jane. So I think, definitely benefit from having those discussions with your community midwife and in how we can support your birth choices. And is there something, that I think it's about understanding why you might want to choose that pathway, and through discussion again around that shared decision making, and having all the information so you can make an informed choice. I think that's important.
And as part of that, we've got a relatively new service that started at the Birth Choice Clinic, which your community midwife can refer you into, or your obstetrician if you're seeing them. Which allows you the opportunity to come in and have an appointment with one of the consultants and a midwife as well to talk through your choices and to see how we can support you with that.
It's not about pressurising you.
No.
It's got a lovely team, hasn't it?
Yes.
Really
very much
non-judgmental,
Yeah.
really supportive. They just want to understand your reasons and what we can do to help you rather than trying to persuade you to do something different.
So Roxy has asked, if you're admitted to the ward, maybe for a couple of days after birth, say, does your visitor have to be the same person, or would her partner be able to come in the morning and her mum in the afternoon?
We recommend that it's the same person, because it's about footfall, it's about the number of people coming in and out of the maternity unit. We want to try and keep it to a minimum. So we request that it's the same person, please. Hopefully most of our women stay in hospital for a very short period of time. We aim to get people to go home within or around about 24 hours post-birth. Obviously some people do have to stay longer for lots of different reasons, but we would hope that you get home to your family as soon as possible, because obviously that's the best place for you. If you will.
Yeah.
And Fiona, thank you, Spinning Babies. So I think we're up to date on questions. Oh, here we go. Fantastic. Each time I think we're running out of questions. Thank you so much. So Kate says she's got a slightly low-lying anterior placenta. This is her first pregnancy and I'm terrified of having a C-section. Is this something more common with these types of placentas? Thank you.
We're all looking at Wendy.
I'm happy to answer that one.
Come on, Emma.
I'm going to do that one. So, Kate, you haven't said how many weeks pregnant you are, but I think the really important thing to say is a lot of placentas sit low early on in pregnancy. And as the uterus stretches and grows, the placenta moves up and out the way of the cervix. So up until your 36 weeks scan, it's difficult to know whether that's still considered a low-lying placenta. But if it is still low-lying and it's considered by, and discussed with you by your consultant, and you do need to have a cesarean, it will be thoroughly discussed and talked about, and you'll have hopefully all of your questions answered. but it's actually quite a small proportion of women whose placentas sit low and then require caesareans for this. Most placentas move up and out the way.
Beautifully answered.
Do you have any additional?
No, I thought I could have answered it.
Harriet, after birthing on the labour ward, what help is available to establish breastfeeding? So you may be seeing, so the infant feeding team do their Facebook Lives, and this isn't replacing that. This is in addition to their wonderful Facebook Lives that they do. But Jane, do you want to say about
Yes, so both on delivery suite, or whether on the spires, whether you go to the observation ward, whether you reach level 5, whichever department you are, immediately post-birth and in the hours after that, you will have midwives, support workers, obstetric nurses, maternity assistant practitioners, student midwives, a whole range of people that can support you with your infant feeding choices, whether that's breastfeeding or formula feeding. So there'll be help in every area. I think my advice to anyone is watch your Facebook Live sessions that our infant feeding team are already doing this. I think to get as much knowledge and information before you have your baby. And I think as well, it's just that it changes each day. I think a lot of people feel that they get different advice on different days, they get different information. That's because feeding changes each day, what you need to do, what the requirements are. So get as much information as possible beforehand, so you're forewarned, you have that knowledge base, and then always people will be available to support you. And then when you get home, you'll have your community midwife, your community maternity support workers, who are also able to offer you advice. Before you get handed over to the health visitor, who can also give you more infant feeding advice. So there's lots of things out there to support you with your feeding.
Yeah, I think we've said, I mean, the girls here do, the infant feeding team do great sessions, as we've said, they're regular. I think it's just that start to think about your infant feeding choices in your pregnancy. Obviously speak to your community midwife during your pregnancy and sort of get the resources out there. Obviously we would recommend that you have skin to skin with your baby following the birth. Obviously that helps with all the hormones and your lactation, and you know, we do sort of advise around antenatal harvesting, so from about 36 weeks you can start expressing your own colostrum as well, if that's something that you would like to do. Definitely the infant feeding team will give you information, your community midwife, about that, and tell you how to sort of access your own colostrum and storing it, etc. And that's, again, it's really key for your sort of feeding journey, if you will. It can be really beneficial for those early days when sometimes babies are a little bit reluctant to feed. If you've got a store of colostrum there, you can use that in those instances. So there's lots of things to sort of think about with infant feeding.
I think another couple of points as well is that we will be encouraging you to hand express after your baby's born. So if you can be familiar with what that means and what that looks like before you come into hospital, that would be really beneficial to you. And you'll also be given information when you leave about what good breastfeeding looks like, how you recognise signs of milk transfer, how you can recognise that your baby is feeding well, and make sure you have that information, you understand it, you know where it is. It's really good information for you to look at and to remind yourself whether or not things are going well, whether you need some additional support. So these are all things you can prepare for before your baby's born, which will give you that heads up, a bit more ahead of the game for when actually the baby comes along.
Okay. So Kate has said, she was asking us about her low-lying placenta, but she said she's 25 weeks, so she's hoping it will move.
Yeah,
Fingers crossed, Kate.
Yeah.
Paula has put up here, excellent, informative session, and lovely to see you all.
Oh, thank you.
Paula, that's lovely. So we're up to date on our questions. We have about 15 minutes left. It will take a few minutes, so still time for any more questions, queries, feedback, anything that you want to ask us to do with midwifery.
Yeah, or as we said earlier, anything that you might want to see in the future with these sessions, because obviously we've got an idea of what information we want to sort of give you, but yeah, there might be something in particular that you'd like to see. So we're very happy to hear your thoughts and feelings around that, so we can try and facilitate it.
So the session that we're going to do that's going to look at the postnatal ward, I'm not sure what week that is, but we know we've got it planned for the future, is that we're actually going to set it up on the postnatal ward, so we can show you around a bay, so you can see what that looks like. We'll go through the ward routine with you, the various checks, the various things that need to happen before you can go home, just so you can sort of visualise what it's all going to look like before you actually get there. So that's one of the ideas we've got for the postnatal ward. I think it'd be quite good. The first time you've actually thought about what it looks like is when you arrive and you walk in the world and you've just given birth. It'd be quite nice to see it in advance and understand what actually happens. I think a lot of people think that you come onto the ward and you're going to go home quite quickly, but there's actually quite a lot of things that have to happen first. Your baby needs to have an examination. You might need to see a doctor. You might need some medication. We have between 15 and 20 discharges a day, so it's quite a lot of people to get ready for discharge, so sometimes there is a bit of a delay. So we just wanted to be able to talk through all of that with you. So that's what I've got planned for postnatal.
I think that's
and I know that Laura for Delivery Suite is planning to do a similar thing, to do their Facebook Live from a room on Delivery Suite to be able to show you around. We've got a couple more things come in.
Okay.
So Helen has thanked us for really helpful sessions, that's great. Charlie has asked, if you'd like to formula feed, do you have to bring your own formula in your hospital bag?
No, we provide formula milk.
And Libby has joined us and has apologised if we've already answered this, but how many birthing partners are you allowed?
One. Currently.
Due to COVID.
Yes, the current situation is one, yes.
Harriet's put it's thank you, it's really useful to do these sessions, especially when we're unable to visit with COVID. Jodie has just commented, I missed this live, but catching up now. We're going to the JR tomorrow. Silver star on a scan to check on the growth of one of my twins. Maybe see one of you tomorrow. Hopefully we will catch up with you. If you see any of us in the corridor, stop us, say hello. And I will hope that it all goes well tomorrow, Jodie.
Good luck, Jodie.
Is this our 5 minute of fame?
Should we reintroduce ourselves then if you've joined? Shall I start? So for those who've missed, I'm Wendy. This is my 6th day in post as the new Matron for Community and Public Health.
And I'm Melissa. I am the Deputy Head of Midwifery for Community Services, Public Health and Safeguarding. So I cover the whole of the community teams and the birth centres and sort of infant feeding, birth afterthoughts, come under my unit as well.
And I'm Jane, so I'm a matron for inpatients, so that's level 5, which is the postnatal ward, and level 6, which is the antenatal ward, and it's also the ward where if you come into hospital for induction of labour, where the vast majority of our induction of labours start. We also lead on bereavement, which is based predominantly on level 7, and recruitment. I recruit midwives. and I'm kept very busy doing that.
Yes, she does an absolutely fantastic job of midwives.
And nurses. Yes, and nurses as well. Emma?
And I'm Emma, and I'm the matron for maternity outpatients and tertiary referral services, and that covers all of the general antenatal clinics where you might come into the hospital to see a doctor, and that may be at the Horton in Banbury or the John Radcliffe. And then the tertiary referral and the higher risk services in the fetal and maternal medicine department looks after the women with the higher risk pregnancies, either in the fetal medicine department or the maternal medicine department, which is also known as the Silver Star team, and also the diabetes team as well. So we've got a couple more questions. Catching up to. Rosalind has said, hi ladies, thank you for the great session. I'm planning on a water birth in the Spires, but wondered how long I would stay post-birth. Thank you.
So it depends really on how you're feeding your baby and whether this is your first baby or subsequent baby. Generally, if everything is well, and if you're choosing to breastfeed and the breastfeeding goes well, and you give birth from spires, you can be home from spires within 3 to 6 hours. We do offer women who give birth from spires who need breastfeeding support to stay overnight. So it might be that after you've given birth, if you don't find you're confident with breastfeeding, we can offer you a side room on spires for you to stay, unfortunately not with your partner overnight, but just to sort of make the most of that breastfeeding support that's there. If you give birth on spires, but we just might recommend some observations on baby, nothing too high risk, it still allow you to stay on spires. You might stay in for an additional 12 hours just to keep an eye on baby. Those are sorts of the average lengths of time, I think, for most women on spires.
I think the key thing here is if mum and baby are both well and feeding well, etc., and the mum, you've made the decision that you're confident in going home, then that will be something that we support.
Thank you. So Mayo says it may not be under this COVID situation, but is donated breast milk available at the moment? So when she was there for her first baby, she found breastfeeding really hard at the beginning, but donated milk really helps.
So absolutely, fortunately COVID hasn't affected our donated breast milk supply. So yes, donated breast milk is available pretty much all of the time. Occasionally, if the supplies are low, then we have to reduce how much we can give, but generally speaking it is available all of the time, and as long as you haven't given any formula milk, it's available for you whilst you're in hospital. Yes.
I hope that helps. And Sally says, hi Wendy, congratulations on your new post.
Thanks, Sally.
You delivered my first baby on Outpatients.
Oh wow! One which is a special place in my heart. It was where I went as a qualified midwife. So yeah, that's amazing.
Yeah. So she wants to know where the community units wanted and should be reopening for births.
So we've talked about this, haven't we? We're literally reviewing it this week. Ready for Monday. At the moment, we've just got a lot of midwives off sick or unavailable for other reasons. Mostly as well, COVID has taken a hit on our staffing. And it's meant that we've not been able to provide the on-call service that we wanted to provide. So it's the way you probably remember, I might have even been on-call for you. So overnight we'd have the on-call midwives go and staff wanted for women who wanted to birth there. We're not able to fill our on-calls essentially, and it also means that staffing in the hospital is also low, so that any midwives we do have available might be needed elsewhere. So we're sort of trying, what the point of it was we were trying to achieve was sort of streamlining where our midwives went, so we didn't have them spread so thinly across multiple different services. Have I summed that up?
Yeah.
Okay. I'm sorry as well. It's that you had your first baby at Wantage and that potentially might be closed, but I hope it was a good experience the first time round at least.
Well, I think the fact that she's recognised it.
Even the last one as well.
Helen is asking, can women stay overnight at the Horton if needed?
Yes, they can. Yeah. I think if you birth at the Horton, then that is staffed 24 hours a day, 7 days a week, so that is available to you. Yeah, if you feel that you need that rest period following the birth of your baby. Yes.
And Maya has gone. She asked a question about the donated breast milk and says it's great and she'll definitely donate if she's able to.
Thank you.
So we're up to date. We're on our last few minutes. So if there is anything else anybody would like to ask. One thing I was thinking, actually looking just around us now, is that whether people wanted to know about the uniforms and what different uniforms meant. So I can come into hospital and see a sea of different uniforms and different colours and wonder.
So you need to come to shop a bit more. Shop the yellow.
So Melissa wears gold.
So I've got the gold trim, so that will be the Director of Midwifery you would see in gold, and also myself and B. Culligan, who's the second Deputy Head of Midwifery. So B covers the tertiary and inpatient services, so the three of us have the gold trim.
So we have the red trim, so we're the matrons. There's not very many of us, so in fact you've got 3 here. I bet you've got almost seen us all. Laura to join us. So we've got the red trim. Our midwives wear royal blue with a white trim. Our obstetric nurses wear white with a blue trim. Our support workers wear like a very light pale powder blue. Our delivery suite staff all wear scrubs. So regardless of who they are, they all tend to wear the same set of scrubs.
Band 7s are this colour with white trim.
The ward managers and the specialist midwives. So some of the midwives that work on feeding maternal medicine, the infant feeding team have green trim. So a specialist midwife has green trim.
And we should all have the little yellow badges that say who we are and what our role is.
They are still being delivered.
Wendy's only not the only reason you haven't got one.
Okay.
That's all, you will be getting one.
Thank you.
Yeah. I was just going to say, we have about 400 midwives working for the Oxford University Hospitals NHS Trust, so it's quite a lot of midwives. We have about 150 support workers, around about 15 obstetric nurses. So there is a lot of us really. Quite a few are not available at the moment because of COVID.
And just going back to the badges, I think what everybody should as well be wearing, we try and hope that everybody's got the yellow badges, but you can always ask to see staff members' ID as well. Every staff member will be carrying an ID with them, and it's never a problem. If you want to ask to see the ID, please do. Nobody will be concerned about showing you that. Well, I think we've silenced everybody. We have 3 minutes left. So the infant feeding Facebook Lives are still continuing.
Yeah.
Very much so.
And remember, just to post up, as Melissa said earlier, if there is anything at all that you want to see happening on these sessions.
Just put it in the chat and we can take a note of that afterwards and we can have a look at that.
Yeah, because we want to be giving you the information you want to hear about, so happy to hear what you'd like.
Well, I think we probably will draw it to a close. We don't have to eke it out to the very last minute if everybody has asked everything that they want to.
Yeah.
But we'd like to thank everybody for
very much so.
watching.
We look forward to seeing you all again, or seeing your chat anyway.
And I think it's posted for re-watching anyway, isn't it, the video? So if there's anybody who wanted to sort of refer back to it, then that option's there for you as well.
Absolutely. Thank you very much.
Thank you.
Thank you so much.
Bye.
Bye. Bye.